This program is made possible by the generous support of the American people through the United States Agency for International Development, USAID. When we think about health services and medical treatment, we may think first of highly qualified doctors working in big hospitals. But with over 85% of the population of Nepal living in rural areas, the real backbone of health services in Nepal is the village-level health posts and sub-health posts, along with the health workers and female community health volunteers working at the community level. The functioning of rural health services would be impossible without the work they do. And the great accomplishments Nepal has achieved in reducing child deaths and enabling couples to have more control on family size would not have been possible without this work going on at the village level. We can see how the system works in Samshergunj, a village in Bankhe district in the mid-western Tarai area of Nepal.
My name is Kusma Sunar. I am from Prempur, Samshergunj, Ward number 5. I live with my 2 daughters, my husband, my mother-in-law and my niece. I didn't know much at the beginning of my pregnancy. I didn't know about these danger signs. I didn't know about mother safety pills. Now I know much better what to do through pregnancy and with a new baby. The female community health volunteer Sister Biva came various times to our house and gave me advice on different topics. I need to be eating well, such as fruits, beans, liquids and vegetables. If I have danger signs like bleeding or fever, I need to go to the clinic. I need to be going for my checkups and to be planning for the delivery. There was a big difference between my previous birth and this last one. This time Sister Biva visited our house from when I knew I was pregnant. After 4 months, she told us about taking TT injection. I took TT injection twice. She gave the cards with health information when I was about 7 months pregnant. She told me to take the mother safety pills immediately after the birth. Sister Biva comes and teaches about care of the baby also, to give nutritious food to children, what the mother should eat, about vaccinations and polio drops, where to go get the vaccinations and on what day. Sister Biva says that it is good to wait at least 2 years before having another baby and that there are different methods that can be used for family planning. She has encouraged me to talk with my husband about these things. I need to discuss this with her more. I'm taking pills now and I don't want to have more children. I remember the very difficult time in my life when my first child was very sick and how FCHV Biva helped to save the life of my child. She found that my child was suffering from pneumonia and she gave the proper medication, the courtroom antibiotic. I'm very much grateful to Biva Didi for her immense help. Biva also helped me when my second child was sick with diarrhea and fever. She was sleeping on the floor, then I went to Sister Biva. She gave packets of rehydration salts for the diarrhea, but my daughter didn't get better. I went again. She advised that the illness needed to be taken care of at the health post and she came with us. There she was well taken care of. They put in a needle and gave her a fluid drip. Biva's sister asked the health workers to give us treatment without a fee.
With the help from her female community health volunteers and staff from the health post, the family is doing well and both daughters are in good health. Biva Gurung works as a farmer and she makes clothes for people in her village. And as a female community health volunteer, she works to improve health in her community.
My name is Bibha Gurung. I live at Prempur, Samshergunj, VDC. I have worked as a volunteer for 9 years. It is said that service is a matter of religious duty. I am happy with this work, though I don't get money for this. I don't think that money is everything. Being born as a human being, we must do something for our community and for our household.
As a volunteer, she gives service to her community in different ways. Her main areas of support include counseling on family planning and on the health of mothers, infants and children.
When women here become pregnant, I give them advice on taking iron pills, visiting the health post, receiving their tetanus injections, eating healthy foods. I give this advice to them along with their husband, mother-in-law and other family members. I also advise them on being prepared. If there are signs of danger, we tell them to promptly visit the health post. We also encourage them to have the delivery at a clinic or hospital. For deliveries at home, we encourage them to take mother safety pills to prevent bleeding, and we give special cards that explain these messages using pictures. While the woman is pregnant, I usually visit 4 times and then again twice after the birth. When I go right after the birth, I check to see if she had taken the mother safety pills. During that visit, I check to make sure that mother and baby are both doing well. I give iron pills and vitamin A and give advice on danger signs and other things. I explain that mother needs a medical checkup, the weight of the baby needs to be taken. I also explain about taking care of the baby, keeping the baby warm and protected from infection, checking to make sure the baby is being breastfed properly. We also make sure the child goes for BCG vaccination soon after birth and that the baby also goes for the rest of the vaccinations. Some people forget the date of the vaccination. They do not know about DPT and the doses of measles and which disease this vaccine helps to fight. We advise them on such topics. Mothers groups are made up of mothers interested in learning about health, married women who are mothers or may become mothers. Some are older but still interested to learn. They come and become members of the mothers group. We discuss one topic each month. We discuss topics like nutrition, sometimes we talk about care of the mother, and sometimes we talk about family planning.
Village health workers supervise and support the work of female community health volunteers.
जानकारी नभएको मानिसहरुलाई जानकारी राम्रोसँग दिउँ भनेपछि त्यो कुरो अवश्य पनि आज पनि भोलि त प्रयोग गर्नमा आउँछन् के तिमीलाई फाइदा हजुरकै फाइदाको लागि मेरो नाम दुर्गाबहादुर हमाल हो
My name is Durgabahadur Hamal. I live at Persenipur, Ward number 6, Samshergunj. I am the village health worker for this health post.
म शमशेरगञ्ज गाविसमा कार्यरत छु मैले यो गाउँघरमा हाम्रो काम के सबभन्दा मुख्य कुरो EPI
I give vaccinations to children below 1 year in the village. and tetanus injections to women. We operate outreach clinics in different villages. In these clinics, we also distribute temporary family planning methods, including depot injection, pills, and condoms. We also distribute ORS salts for diarrhea, and we treat sick children, including those with pneumonia in these clinics.
त्यसलाई पनि अब एउटा जाने स्वास्थ्य शिक्षा दिने र साथै श्वास प्रश्वासको जाने निमोनिया सम्बन्धको जाने उपचार पनि हामीले गाउँघर क्लिनिकमै गर्छौं महिला संस्थासँग हाम्रो उहाँहरुसँग सम्बन्ध हुन्छ.
We work together with the female community health volunteers. When there are training activities or review meetings, we help lead and give training. When we have our regular monthly meetings with them, we collect their reports from them and we resupply any of their medicines or materials that are lacking. In the village, we counsel on family planning and are able to provide temporary family planning methods.
परामर्श हामीले दिएर यो काम पनि हामीले गाउँघरमै नै हाम्रो फिल्डमै नै गर्ने काम हो.
The auxiliary nurse midwife is another important member of the health post team.
मेरो नाम दुर्गा श्रेष्ठ हो.
My name is Durga Shrestha. I am an ANM. My house is in Adarsh Nagar, Nepalganj. I have worked for 20 years as an ANM. I have been posted at Samshergunj health post for the last 2 years.
अहिले हाल चाहिँ 2 वर्षदेखि शमशेरगञ्ज हेल्थ पोस्टमा कार्यरत छु. हामी कहाँ पेट दुखेर एउटा महिला आयो भने
We give advice to pregnant women on problems they may have and for what conditions they need to come to a clinic. We use a flip chart in our counseling. We advise them to visit the health post or hospital if they have headaches, dizziness, blurred vision, swelling of hands and feet, pain in the lower stomach or any trace of blood. We inform her family about these danger signs and advise them to promptly take her for treatment.
अनि उहाँहरुले चाहिँ हामी एएनसीहरु चेकअप गराउँदाखेरि हामीले सामान्य डेलिभरी हुने.
For women who have had a normal pregnancy, we have them come to the health post to deliver. We give service even up to 6 to 7 p.m. in the evening. We tell them to come to the health post or go to the hospital, whichever is convenient for them. We tell them that if they want to deliver at home, they can call me. We can take all our supplies and equipment to their homes and help in the delivery. We also give them vitamin A and iron tablets after delivery. And we complete the child delivery record.
आइरन चक्कीहरु पनि हामीले त्यसरी दिन्छौं र हाम्रो आफ्नोमा रेकर्ड राख्छौं. उहाँहरुलाई जस्तो भिटामिन ए.
We give the women information on vaccinations that the baby will need. We explain where to go for the vaccinations. If they are from this village, they can come here to the clinic. If they come from a different village, we tell them where and when to go for the closest outreach clinic.
एउटा महिलालाई एकदमै गाह्रो अवस्था हो.
Pregnancy can be a very difficult time for women. Men should help their wives in household chores and making sure they get checkups and in providing everything needed for the delivery and afterwards.
पुरुषले पनि सहयोग गर्नुपर्छ.
The one responsible for the health post is the clinic in charge.
मेरो नाम बालकृष्ण चौधरी हो, पद जनस्वास्थ्य निरीक्षक र यो शमशेर.
My name is Balkrishna Chaudhary. I'm the in charge for Samshergunj Health Post. As a manager, I look after administration of this clinic.
व्यवस्थापन पक्षहरु चाहिँ मिलाउँछु. बिरामी जाँच्नेहरु कामहरु गर्छु.
My duty is to check patients, to look after the cleanliness and repair of everything at the health post.
भयो सबै कामहरु गर्छु र यसका साथसाथै
I also look after the work of the female community health volunteers and make sure that the service in the health post is of good quality.
हेल्थ पोस्ट नियमित रूपमा चलोस् र गुड गभर्नरको लागि पनि धेरै ध्यान दिएर त्यो कामहरु गर्छु. पूर्वाधारहरुमा चाहिँ त व्यवस्थापन समितिको चाहिँ धेरै प्रभाव छ.
The health facility management committee helps to oversee the services to be provided. The management committee works out how to increase the quality and range of services given through the health post, and they give tasks to the staff to follow up.
त्यो व्यवस्थापन समितिमा हामी चाहिँ निर्णय गर्छौं हैन. निर्णय गर्ने अनुसार जिम्मेवारी चाहिँ हामी दिन्छौँ।
Local health facility management committees have been formed to help ensure high standards for health services and better management of the health facility.
हामीले यो स्वयंसेविकाहरूको लागि ड्रेस दिने गाउँ विकास समितिबाट 15 जनालाई ड्रेस दिने निर्णय चाहिँ भएको हो।
किन अब जिल्लाको एकरूपता भयो भने यो गाविसको महिला स्वयंसेविकाको कलर अर्को गाविसको अर्कै भन्दाखेरि त चिन्न नै अलिकति गाह्रो हो। एउटै भयो भने सजिलो हुन्छ कि
हालको स्थितिमा जो चाहिँ गाविस अध्यक्ष हुनुहुन्छ नि
Normally, the VDC chairman would lead the management committee, but due to the present political situation, this responsibility is being covered by the VDC secretary. Other members are an elected female resident of the ward, the principal of the local school, a member of the village development committee, one of the female community health volunteers, a female Dalit representative, a representative of indigenous ethnic group, and finally the health post in charge, who serves as the secretary.
My name is Kokila Pariyar. I live in Ward number 7 of Samshergunj Village Development Committee.
दलितको प्रतिनिधित्व गरेर सदस्य भएकी छु। हामी दलितहरूलाई अब केही पनि थाहा थिएन अब।
I'm a Dalit and a member of the management committee for Samshergunj Health Post. We Dalits were ignorant. We were not articulate. We didn't know where to go. We've been able to solve our problems, and we've been participating in this committee and discussing and sharing our problems with others. We can solve anything if we can come together. Dalits are now receiving services and their voices have now been heard in this committee.
दलितहरूले पनि सेवा पाउँछन्, यस समितिमा आवाज पनि सुनेकै छ।
हेपो सञ्चालन तथा व्यवस्थापन समिति
The management committee is very important. It functions well, ensuring proper management of the health post.
गाविसले हस्तान्तरण गरेको हुनाले व्यवस्थापन समितिको भूमिका एकदम अहम छ।
We hold regular meetings on the second last day of each month. First, we confirm we have a quorum. Then, we review decisions from the previous meeting and discuss what was completed or not completed. We then decide on what needs to be done. We sometimes talk about how things are going at other health posts and what services they are giving. If our goals were not met for antenatal care, for example, we discuss how we can improve and how we can reach our goals.
Following instructions from the management committee, we are now properly disposing of dangerous waste from the health post. The waste is burned. Apart from this, as per the decision of the management committee, we have completed the work of making a wall around the health post. Samshergunj Village Development Committee Health Post is providing a valued service to the community through the active participation of local residents, female community health volunteers, health post staff, and members of the Health Facility Management Committee. This program is made possible by the generous support of the American people through the United States Agency for International Development, USAID. The contents are the responsibility of JSI Research and Training Institute for the Nepal Family Health Program and do not necessarily reflect the views of USAID or the United States government.